দর্শক, অসংক্রামক রোগের অন্যতম হৃদরোগ। সঠিক সময়ে এই চিকিৎসা না পাওয়া সহ বিভিন্ন কারণে প্রতি বছর ৩ লাখ মানুষ হৃদরোগে আক্রান্ত হয়ে মারা যান। তবে গেল এক দশক ধরে মালয়েশিয়া বিশ্বব্যাপী উন্নত কার্ডিওলজি চিকিৎসা সেবার জন্য স্বীকৃতি পেয়েছে। দেশটি এশিয়ার কার্ডিওলজি হাব হিসেবে নিজেদের প্রতিষ্ঠিত করেছে। মালয়েশিয়ায় হৃদরোগের চিকিৎসার বিস্তারিত জানাবো আজকের আলোচনায়। আপনাদের সঙ্গে আছি আমি ডাক্তার সামিউল আওয়াল স্বাক্ষর, আর আলোচনার জন্য বিশেষজ্ঞ হিসেবে উপস্থিত রয়েছেন কনসালটেন্ট কার্ডিওলজিস্ট ডাক্তার আফিফ এবং বাংলাদেশ কান্ট্রি ম্যানেজার মিস জিনাত। ওয়েলকাম টু আওয়ার টুডেস program.
Thank you very much for having us.
Yes, today we are discuss about the very important issue. So, can you describe yourself?
Afternoon to everyone. My name is Dr. Afif Ashari. I am a consultant cardiologist from Institute Jantung Negara, or IJN, or another name for it is National Heart Institute of Malaysia. So I will pass to my country manager, Ms. Zinat, to explain about our institution.
Okay, fine. It's your turn, Ms. Jinat.
Assalamualaikum. My name is Zinat. I am the country manager for Bangladesh market to Malaysia. We are here today to talk about the National Heart Institute of Malaysia, which is also well known as IJN, Institute Jantung Negara. So basically, Institute Jantung Negara, or IJN, is a premier cardiac center which offers complex cardiology and cardiothoracic treatment both for adult and pediatric patients. We cater from a very simple checkup or outpatient treatment to the most complex heart surgery, heart conditions patient. And we are very, very well known in this field of cardiology in Asia Pacific as well as, worldwide.
Fine. Now, Dr. Asif, can you tell us about your role at IGN and your experience also?
So I used to train back in the United Kingdom in BATS and the London Medical School. I worked in the United Kingdom for 5 years, and then I came back to Institute Jantung Negara for my cardiology training. And I did a subspecialty under cardiology in cardiac imaging. So I went for 1 year training in Royal Brompton Hospital in London. So my specialties in Institute Jantung Negara, or IJN, is cardiac intervention and also cardiac imaging, specifically cardiac MRI. In general, the roles of a cardiologist in IJN mainly ranges from seeing general stable patients in clinic to daily ward rounds, and I will have 1 day a week lab day or procedure day where we will do angiogram and angioplasty. And I will also have a list of cardiac MRI reporting that I will cover about 1.5 days in a week. Apart from that, we do the occasional on-calls where we cover emergencies, where patients come in with emergency conditions, including heart attacks, heart failure, and we will treat them accordingly and until they are discharged, and then we will also follow them up accordingly.
Okay, fine. What are the most common cardiac problems affecting people today?
So I think the most common and cardiac condition that people worry about in general is ischemic heart disease or coronary artery disease. So this, in the more layman term, is called heart attacks.
In all over the country?
Everywhere in the world, this is a massive problem. So cardiovascular disease is a big problem, and because most of the time, the risk factors for this condition can go, cannot be picked up if individuals don't get themselves checked up. So sometimes they may have undiagnosed diabetes, high blood pressure, or high cholesterol, and sometimes they present first of all with the complications first. So sometimes they come with into hospital with heart attacks, and that's the time we diagnose them with diabetes or high cholesterol at the same time. So this is the one that is problematic, and we need to tackle them earlier if possible.
Thank you. Now, Ms. Jinat, what are the facilities you provide at IJN?
At IJN, we provide from a very simple medical checkup, as I mentioned earlier, to the most complex, surgical procedure up to heart transplant. Though heart transplant is only available for Malaysian citizens, but nevertheless, it's still available, within our hospital. We do, TAVI, we do LVAD, we do pediatric complex cases. And our doctors at the pediatric complex, from the pediatric units, will also be here in Dhaka in a day or two, to assist some of the cases at the National Heart Institute of Bangladesh. Yeah.
Dr. Afif, how will you maintain this specialized case in your cardiac center?
The good thing about working in IJN itself is First of all, we see ourselves as a center of excellence in cardiothoracic care. So we are a referral center across the country. So we will receive, apart from our own pool of patients, we will receive referrals from other centers across Malaysia, be it district hospitals or even big centers. And so you receive a lot of complicated cases. And we have high volume of patients all year. So for example, in a lab day, we have about 6 or 7 lab, and we do angioplasty or even electrophysiology cases for devices and things like that. And in a day, we can do up to 60 or more than 60 cases. So in a year, it's about more than 10,000 cases. So by maintaining these numbers and also having referrals for complex cases, we have a lot of, even among cardiologists and consultants, even different specialty across our board, cardiothoracic surgeon. So we are able and capable to deal with all the complex cases. I think that's one of, and having continuous big numbers, I think, help for us to maintain the skills and the required confidence to treat these complex cases.
Okay, definitely. What are the latest advancement in cardiac side that IGN offers?
Okay, there are quite a few advancements, not necessarily the latest ones, but especially because the focus is about coronary artery disease. I think in cardiac intervention, we have a lot of new techniques that we can use. For example, the stents that we use, there are different types. There are newer generation stents. There are bioresorbable stents that are also available in IJN. And for angioplasty, for example, nowadays there are a lot of intravascular imaging that is used to optimize the angioplasty, to size the stent better, to optimize the deployment of the stents. So this will make the outcome better compared to those centers who perform it without intravascular imaging. And apart from that, not only in cardiology, we have the tools for advanced and complex high-risk cases. We have cardiac support. We have ECMO available in our center. And also our surgical team is very capable if in cases that need bypass surgery, and we also have some other specialties, including vascular on board, and our anesthetics in our hospital is also very good.
Ms. Jinat, how IGN assist Bangladeshi people in their medical journey to Malaysia?
We have a very dedicated international patient center in IGN, which is contactable 24 hours, 7 days a week, whereby they can drop their, their inquiries, even their medical reports to us, and we will connect them to the right doctor because, cardiovascular and cardiothoracic is a very big, big element where we have over 190 doctors or cardiologists to take care of the heart. So every doctor normally have their own specialty, you see. So the International Patient Service Center will help the patient to see which are the relevant or the most suitable doctor for this particular case of a patient. So that is very important, I think, getting the right doctor for the right treatment. This will also, in a way, save the cost of the patient, by not going to different doctors, getting different tests, unnecessary tests, which will also incur the cost. And beside this, we will also arrange for teleconsultation for the patient if there is a need. For an example, a patient, is due for LVAD, you see, and the patient have never traveled to Malaysia before and have never seen IJN's or IJN's doctor. So this is where our people, myself, come into the picture. We will arrange for consultation. Patient can see the doctor and the doctor can see the patient virtually, where the confidence will be built better. The patient will have more trust in the doctor, in the institution, and for the procedure the patient that is going for. And beside that, we will also help with the visa application or visa extension for the patient. We will recommend which hotel is nearby so that the patient do not have to travel very far from the hospital. Normally, we will suggest walking distance hotel for the patients or the patient's family members, so that it will be easier for them to come back to the hospital every other time when there is a need, especially when someone is admitted, the companion, the family members. And not only that, we also have the facility of airport pickup, airport drop-off for patients and the families. Yeah. So these are some of the things that IGN offers to ensure a smooth journey for the patient, because it's not easy to be away from home.
Definitely.
You know, and on top of that, when someone is sick, we truly understand. So we try to make it as comfortable, as smooth as possible, so that patient do not have, you know, patient journey is smoother, is seamless. Yeah.
Sure. What is the outcome of teleconsultation?
Oh, teleconsultation, I think it came into the picture since COVID hit us, you know, worldwide.
Yes.
So I think the outcome of having teleconsultation is very good. That's where patient normally, you know, it's benefit the patient more than the doctor, because doctor have to spend their extra time. And this teleconsultation that I'm talking about is free of charge. We normally don't charge a single cent for this teleconsultation. And what patient get out of this is, you know, they are more confident. They know who are they going to be treated by, who are they going to get treatment from, and what type of treatment, and they know they will see the doctor in person. I think, which is very important, yeah, for any type of treatment, yeah.
I think that's a better sign. Actually, Dr. Afif, what are the warning signs for heart patients that should not ignore?
Okay. So I think in respect to coronary artery disease or ischemic heart disease, chest pain is one of the main symptoms that you need to look out for. So chest discomfort related to ischemic heart disease tend to be from the center of the chest, or it can go to the left side of the chest, sometimes radiating to the neck or to the arms. Usually it's worsened on exertion. So in general, most of the heart conditions is symptoms that's worsen on exertion, be it whether they get chest discomfort or whether they get breathlessness. So those are the two main symptoms, but there are other symptoms to look out for. So sometimes when they have more severe conditions like heart failure, whether due to a heart attack or due to other conditions, sometimes they can have abnormal rhythms, which can cause them to have palpitations or feeling their heart racing. So this, if more severe, can lead to someone passing out, or at worst case scenario, can lead to sudden cardiac death and things like that. So these are some of the symptoms that you need to look out for. If you do have chest pain or feeling breathless that is unexplained, I think better to get checked, either screen with a cardiac test, at least blood test, and maybe consider doing an echocardiogram, which is a scan of the heart, or also doing a stress test to make sure they don't have underlying coronary artery disease.
How can patients from Bangladesh actually benefited from IJN, from cardiac expertise?
IJN is a Center of Excellence for Cardiothoracic Care. So, I mean, our center is focused on treating mostly cardiac patients. We do treat patients with other conditions than heart disease, especially if they have cardiac problems as well. So we have specialties across the board. So like I mentioned, we have cardiologists. I am an adult cardiologist who treat mostly coronary artery disease, heart failure. But there are complex cases that may be suitable for surgery. And we have excellent surgeons in our center which do bypass surgery if they have multiple blockage in their arteries, and they can also be very capable to do valve interventions. And for example, when we talk about newer technologies, I didn't talk about the others outside interventional cardiology or angiograms, but we also have newer catheter-based interventions for the valves. So we are doing some catheter-based intervention, meaning no surgery for the valves, in selected cases, of course, especially if they're higher risk for surgery. So for example, I think Ms. Zeenat mentioned about TAVI surgery, which is a transcatheter aortic valve implantation. So instead of having an open heart surgery, patients will go a procedure mostly accessed through the groin, and valve will be implanted via the access from the groin. So this certainly reduces the morbidity and complications related to a surgical procedure, and also reduce the stay in hospital, and allows higher risk patients to undergo valve repair or replacement. But of course, these are selected cases and need to be discussed thoroughly, and usually we do routine meetings among surgeons and the interventional cardiologists before we decide the suitability for these sort of more complex procedures. But this will definitely, when you want to go to a center, you certainly will feel more confident if the center is capable of treating complex conditions. And we have a lot of variety of specialties across the board that are capable to handle all the complex or even sometimes if unexpected complications, because it's part of any procedures or in any treatment. So we need to have a good, with that capability of all the specialties across the board, I think Bangladesh patients should have confidence with the treatment in our center. And other than that, I think, of course, our as an international, not everything is about the medical side. Of course, we are a Muslim country as well, Malaysia. So as Bangladeshi patients probably will find it easier to access even the food, mostly will be halal. And I mean, apart from that, there's also a lot of tourist attractions. Because when you come for healthcare in another country, you will be expected to stay for at least more than, if you're going for a procedure, definitely you will need to stay for about a week or so, because we cannot expect after a procedure, you'll be going home on a flight just the day after the procedure. So most of the time we will expect them to stay longer. So just by coming to a Muslim country as well, I mean, there's a extra non-medical side of things. And the last thing I just want to mention, I think Ms. Zina mentioned about we are a JCI accredited center. So JCI is just a Joint Commission International. So which is a standard, like an audit standard that is quite difficult to achieve, but we've been doing it regularly every few years. So it's something that we are really proud about in IJN. So we are fulfilling certain strict criteria internationally, and then that sets the standards and prove our clinical excellence.
Okay, very nice. Ms. Jinat, how can Bangladeshi patients book an appointment or get a consultation at IJN?
Oh, I am the country manager, as I mentioned earlier, so can get in touch with me via WhatsApp. So I will provide my number, where, you know, if in the event someone need any type of assistance when it comes to cardiac related, yeah, they can get in touch with us.
Dr. Afif, how will you handle the cardiac emergency situation?
Okay. So in IJN, mostly the emergency situations will be handled by the on-call team. So for example, when I am on call, all of the new patients' admissions, if they're not known to IJN before, will be admitted under my care. But the most critical emergency in adult cardiology, as myself, emergency heart attacks, or what we call ST elevation MI. These are the cases where they have heart attack where they need to be treated immediately. So in these sort of cases, for example, we have a system of network around the Kuala Lumpur area where the centers outside or nearby our region will call to our emergency department immediately, and they will inform if these type of cases is referred to our center. And then if these cases are referred, the lab will be activated, and within 30 minutes, the cardiologists, the lab team, including the radiographers and the nurses, will be expected to arrive. And by the time the patient reach our hospital, once they are agreeable for the procedure, we will bring them straight to the lab for angiogram and angioplasty. And most of the time, will be treated accordingly based on how many blocks are there. So those are one of the examples, and we have a lot of standards for this as well. For example, we need to treat them to get them to the balloon, from the door to the balloon within 90 minutes, and we have been achieving these standards as well. So in emergency heart attacks, time is crucial. So it's a good question, because these are the emergencies that sometimes as a cardiologist, the satisfaction is the most when we treat these emergency angioplasties, because you can see the improvement almost immediately once we suck out the thrombus or the blood clot, or even once we start putting the stent, then the patient will say they'll have no more pain. But if this is untreated for a few hours, this can lead to the complications I mentioned, whether they will have arrhythmia, abnormal heart rhythms, and they will collapse or lead to sudden cardiac death. Or sometimes they will have, even though if they're not treated, sometimes they might survive, but they might have comorbidities, including heart failure, and they will feel breathless for a long time, and they have to be on a lot of medication. So it's important to treat the medical emergencies very early.
Can you share a success story of Bangladeshi people treated at IJN?
Okay, so I think, not to say a success story as such, but I think when we talk about international patients or Bangladeshi patients, most of the time what we need to understand is this group of patients, the needs are different in the sense that the time scale is a lot less. So when they come to another country, they cannot be expected, we cannot give them a follow-up in 2 weeks, 1 month with a test, and then we come back and decide whether they need procedure, be it whether they are stable. If they need to, usually the expectation is they need to settle everything within that period. So I mean, the good thing in IJN is we are relatively flexible to accommodate that. So one of the ways they can come is whether they come via our screening clinic or they come and see in our private clinic, in our clinic in the cardiologist or the consultant cardiologist, and then either they do a stress test, and if they end up needing an angiogram, we will usually do it very quickly, within 1 or 2 days, and then once they are done, usually the angioplasty will be completed, and once the angioplasty is completed, within the next day they can be discharged. But as I mentioned earlier, it's not that they can go home within the next 1 or 2 days. Usually we ask them to rest. This is the time where they either stay around the Kuala Lumpur area, or they can go travel or enjoy the food or delicacies in Malaysia.
Sure.
Yeah.
Okay, fine. Now, Ms. Jinat, sometimes Bangladeshi people wants to know about the costing issue.
When they first get in touch with us, when we have the full medical reports, consultation, let's say there is a need for the consultation takes place. From there, we will be able to advise, even before they get their ticket, what is the cost like. We will tell them upfront, this is the costing from the starting to the end, from A to Z, you see. So the patient will be advised on the rough estimation costs before they fly into IJN.
Thank you. Dr. Afif, what advice do you have for maintaining a healthy heart?
Most of the time, there's a lot of risk factors related to heart disease. Is related to lifestyle. So of course, exercise, maintaining a good lifestyle, including exercise and maintaining a good diet. When you say good diet, generally entails of having a balanced, healthy diet, which is less of the oily and fatty food, less of the sugar or carbohydrates, and having more of the fibers and vegetables. But what is more important is, I think, identifying the risk factors related to heart disease. So of course, you need to lead a healthy life. But even if you're healthy, sometimes there are conditions that get undiagnosed. So for example, as I mentioned, the 3 major conditions is diabetes, high blood pressure, and high cholesterol. And these 3 conditions generally are missed. I mean, because they don't have symptoms. You may say someone might have headache if they have high blood pressure, but not everyone with high blood pressure will have headache. And high cholesterol and diabetes, if you ask me what are the symptoms, most of them are vague. And people can go at 40, 50 years old and have diabetes or high cholesterol without knowing it if they haven't had a single blood test in their life. So the more important thing for me, I think, is the screening part, be it being just a simple blood test, or if they have more risk factors, if they're higher risk, they should go for cardiac screening as well. This usually include a stress test or even an echocardiogram. So if required, we will pick up the heart disease earlier. So like I mentioned before, they don't come to hospital with a heart attack and then we treat. So we treat them before they have the heart attack. So this will lead to better outcome in general, because once you've had a heart attack, you'll have complications related to it. You'll be having more medications and things like that. So it's, in a way, it's a sort of a cliche where we say prevention is better than cure, but it is actually very true in cardiology, because there's a lot of things that we can do before the actual disease or complications come.
Okay, Ms. Jinat, any representative office available in Bangladesh?
Yes, we do. We do have co-working partners here in Bangladesh. That is Aring Group. They are located in Bonani. And I think maybe we may want to provide the number so that, let's say the audience have got any questions or anything that they want to ask about appointment or whatsoever, they may contact Aring Group for the information.
Maybe that will be helpful for Bangladeshi patients.
Yes, that will definitely be helpful.
Hope this is a very nice discussion. Thanks a lot, Dr. Afif and Ms. Jinat, for joining us today.
Thank you very much for having us.
বলা হয় মালয়েশিয়াতে 50টিরও বেশি মানসম্মত হৃদরোগ নিরাময় সেন্টার রয়েছে, যা প্রতিনিয়ত দেশটিতে হৃদরোগের চিকিৎসার জন্য আসা মানুষকে সেবা দিয়ে যাচ্ছে। মালয়েশিয়া একটি মুসলিম প্রধান দেশ, যেখানে চিকিৎসা সেবার খরচ ইউরোপ এবং সিঙ্গাপুরের তুলনায় অনেক কম, তবে সেবার মান বিশ্বমানের। আজকের আলোচনার সূত্র ধরেই বলতে চাই, দেশটির আধুনিক চিকিৎসা প্রযুক্তি এবং অভিজ্ঞ চিকিৎসকদের সেবা পাওয়ায় বিদেশি রোগীদের কাছে বেশ আকর্ষণীয় হয়ে উঠছে। আসছে সময়ে এই চিকিৎসার পরিধি আরও বৃদ্ধি পাক, সেই প্রত্যাশায় শেষ করছি আজকের অনুষ্ঠান। ধন্যবাদ সবাইকে।